Hello friends, welcome back to Dr. Arshad Nadeem Awan Ultrasound and Radiology teaching videos. Hope you're all okay, you're all enjoying your life, and you're also enjoying watching my videos and also practicing radiology and practicing ultrasonography. So a lot more are there for the enjoyment, so I do hope that you are enjoying your life otherwise. So today my topic of discussion is simple bone cyst. Simple bone cyst is very common with the age of 5 to 15 years of life, and especially it involves the proximal humerus and proximal femur. Basically, it may be solitary or multiloculated cyst arising from the metaphases and migrate towards the diaphases. But by the time it reaches diaphases, it may resolve. So it may spontaneously resolve. So this is what the characteristic of simple bone cyst. The another distinguishing feature from the aneurysmal bone cyst is aneurysmal bone cyst is always eccentric, while simple bone cyst would be central. So far, the radiological features on X-rays are concerned, it appears as a well-defined lytic lesion with thinning cortex, with expanding the cortex. So this would be the behavior of the simple bone cyst. The another very important point worth noting here, you might see a fallen fragment. So fallen fragment, a fracture segment, a fracture small tiny segment can also be seen within the within the cyst, and that would be falling with the gravity. Beside this, there may be pathological fracture. So how it will appear on the X-rays, how we will appreciate that, how we will differentiate this from the fibrous dysplasia, from the aneurysmal bone cyst. So this all information include in this video. So let's start watching these images. Simple bone cyst is a benign fluid-filled cyst. Usually it is filled with the serous collection, and this is cystic osseous lesion within the bone. Here on this image you can appreciate image has been given, and you can understand that how it appears on the X-rays and what actually it is. So this is what the picture of the simple bone cyst and simple bone cyst will look like. It will fill with usually serous collection, and this would be considered as a simple bone cyst. Simple bone cyst happens to be 85% usually seen in second decades, but for the simple bone cyst, it varies from first to second decade. In between this, you can see simple bone cyst. Especially, it spontaneously resolves when the patients approach it skeletally maturation, or when the growth of the skeleton becomes mature, it automatically resolve. So there is no consensus for the common treatment. As far as the diagnosis is concerned, 50% are proven to be a simple bone cyst, but sometime in some of the lesion you may be able to see septa, there may be loculation, or maybe somewhat inhomogeneous internal contents can also be seen. But majority of the 50% cysts which you can appreciate on the X-rays, it will fulfill the criteria of the simple bone cyst. As far as its X-ray findings are concerned, normally it happens to be centrally located, and that is lytic lesion with a cortical thinning. Well, in the aneurysmal bone cyst, you will see a different pattern, and there will be some, because of the aneurysm, the cortical surrounding thickness of periosteal reactions may be also visible. So far the cyst expansion is concerned, it will cause symmetrical expansion. Periosteal reactions happens when there is any fracture. Usually it seems 6 to 8 centimeter, and it migrates toward the diaphyseal. From the metaphyseal, migration towards the diaphyseal is pathognomic, and beside this you can also be able to see the trabeculations within the cyst. On this X-ray image, you can appreciate a well-defined lytic lesion. The first point is it is centrally located. Second, symmetrical expansion it is causing. A sclerotic border you can also see. Inside the lesion there is trabeculations as well. So in short, it is not seems to be a simple cyst. On X-ray you may include some of the differential with that, but so far the characteristic of this features are concerned, it more look like a simple bone cyst on this imaging. As far as this humeral cyst is concerned, cortical expansion can be seen. It is well defined. It is centrally located. Cortical thinning can be seen. And second thing is there is no internal matrix. There is no surrounding sclerosis in this case, and there is no fractures as well. So this is what the simple bones is classically. Keeping in view the age of the patient, here you can see that the bones are not skeletally mature, so it's mean that the patient is in the first or second decade. So this is a classical example of the simple bone cyst on the X-ray involving the left-sided humerus, metaphyseal and intermedullary. This is another example of the simple bone cyst, just to mention and just to show you that sometime there will be a lobulation, loculation, and sometime there will be internal septation, which sometime mimic as an aneurysmal bone cyst. But keeping in view, like you can appreciate the cortical thickening, the cortical thinning and the cortical expansion can be well seen, and from the metaphysis it is migrating towards the diaphysis. Patient in its second decade of life, and there is no fracture. Here a few example can be shown so far the calcaneum bone is concerned. So in the foot you can appreciate this is a simple bone cyst. So far its MR is concerned. On the MR you can also appreciate that this is a low intensity, and it is confirming that this is a fluid filled cyst. MR, beside the MR, scintigraphy has been also done, which is confirming that there is no uptake of the lesion. So this is what the simple bone cyst is on X-rays, MR and scintigraphy. Now pay attention to the another very important point, that is pathognomonic, and that is called as falling fragment sign. Here you can see there is a pathological fracture. This is again a simple bone cyst, but within the cyst, at the basal part, at the dependent part, you can see a small fragment of the bone, that is a falling fragment sign. Falling fragment sign is a pathognomonic sign for the confirmation, for the particular diagnosis of the simple bone cyst. So whenever there is cystic lesion associated with the fracture, always search for the fallen fragment, and if there is falling fragment, so it's mean this is simple bone cyst. So again there is another example, having a simple bone cyst with a transverse fracture and having a falling fragment within it. So this is a simple bone cyst. This is intermedullary. This is ranging from metaphyseal to diaphyseal. Patient is skeletally immature. This is fracture. So because of the fracture there is a periosteal reaction. Otherwise normally there will be no periosteal reaction unless until there is fracture. So beside the fracture there is another sign which is called as falling fragment sign. You can well appreciate on this image. While discussing the lytic lesions of the hands, we have discussed multiple diagnoses, multiple diseases like inchondromas and SBC and GCT and fibrous dysplasia and like implantation epidermoids, glomus tumors. But here the simple bone cyst is also on the top. You can appreciate that this is lytic lesion, intramedullary, causing expansion, cortical thinning. However, there is no fracture, but a small thin hairline fracture can also be seen, but I'm not pretty sure because of the image quality. So this is what the simple bone cyst involving phalanx. Yes guys, a simple bone cyst and its radiological pattern, its behavior and its appearance on the conventional radiograph has been already discussed. We have also discussed about the MRI, a few points, and also discussed about the scintigraphy. We discussed about the differential diagnosis as well. So I do hope on the conventional radiograph
you will be able to pick this benign cystic lesion quite easily, because it has a characteristic age that is from 5 to 15 years of life before the closure of the epiphyseal plate. So it would be quite easy for you to pick on the conventional radiograph. With some other new information, new video, we'll see each other. Till then, take great care of yourself. See you then. Bye bye.